Absolutely.
All right, we are going to continue our show by getting into the skin. You know, we always have an opportunity to chat with Dr. Andrew Ford. He is our dermatologist, and I give him the opportunity to tell us exactly what we'll be talking about this morning, since I feel only confident with the first half of the words. So good morning, Dr. Ford.
Morning.
I know you're laughing at me,
Hi
so
to the
you go
viewers.
ahead.
You're doing
Del
a better
Canvas.
job every time.
Del Canvas?
Del
Or
Canvas.
Del Canvans? Or
Yeah.
Del
Folliculitis
Canvans?
decalvans.
The Calvins.
You were
Yeah.
close.
All right. There you
Okay.
go.
Yeah, it's one of the scarring forms of hair loss or alopecia. It's thought of as being rare, but in our demographic, it isn't something that occurs rarely because it's something that happens in people with darker skin a lot more than other races.
Right.
It can affect both men and women, but tends to affect men more.
This
And
is what it
this
looks
just
like.
shows you a very subtle form of it. It almost looks as though there's starting with some ingrown hair, just some swelling and bumps around the hair follicles. And that's a very subtle form, but of course it can get a lot more severe. And I have to tell the viewers that you may see some inflammatory bumps and pustules in some of the pictures. And this one shows you more of an end stage form where you get a doll's hair type of appearance, where you get tufts of hair growing out from well, that's one way of describing it. When you have tufts of hair growing out from an area, but you can see that there is hair loss and the scalp is bare. So that can be quite disturbing for individuals not having hair.
Who does this happen to? And
Both men and women.
Is there an age range?
Yes, it happens in the younger age groups, but also in the middle age. So that previous picture showed you the inflammatory collections around the hair follicles.
How much worse can this get? And
Well,
I hope you didn't bring a photo, but you can describe.
Well, I did bring something that gives you an idea, but you can have permanent hair loss and of a scarring form, and hair loss is always a disturbing thing for individuals socially and otherwise. You have to try to camouflage it and cover it, and it creates a lot of psychic trauma for people.
That's right, or you can resort to Rogaine.
Well, in some cases that will help, but this is one situation where Rogaine wouldn't help. But it can start insidiously and kind of quietly with just little bits of soreness and pain, or you might get the occasional bump or swelling. This shows you a localized version of it where you can see the skin is thickened and there's a little bit of bleeding there, and already the hair is starting to
Does it
be
itch?
missing from there. Yes, it can itch, it can hurt, it can be sore, or you can see bleeding on your pillow and crusting and weeping. They're the type of inflammatory changes that you can see.
Okay, what's the difference between this and folliculitis barbi, which you explained to us last time?
Well, that was really a location difference, but ingrown hair is, as we said, a pseudo folliculitis can occur anywhere. So the pseudo means false, and in this case, the infection or inflammation is occurring around the origin of the hair. But last week when we were talking about the pseudo folliculitis, the inflammation occurred around the other part of the hair, the end of the hair that was going back into the skin.
Right.
So it has to do with the origin, but the results can be very similar.
So
And
why would it happen to some people?
Well, this is
particular
an
thing?
interesting question, which isn't understood, but they think that it has something to do with the way your immune system reacts to Staphylococcus aureus, which is a bacteria that's commonly seen in our environment. And also there are many people who are Staphylococcus carriers. We talked about that sometime last year, where you could carry a bacteria in your nose, but yet only a minority of people who would be carriers would have this condition. So it has to be some special relationship between the individual who's susceptible and the bacteria, which the immune system doesn't seem to try to keep it in check.
How do you treat this condition?
Well, early treatment and identification is the most important thing, because if you're going to have hair loss, that's something you want to prevent. But of course, disinfectants, not using greasy things on the scalp, and antibiotics are the mainstay of treatment. They can be topical or in the form of liquids, but oral intermittent antibiotics is the most common form of treatment, or it can be low doses over a long period of time, just like you would for acne or one of those other things. Other treatments have been tried as well, intralesional steroids for swelling and thickening and scarring, and also off-label use of an acne cure, which is taken by mouth, has been used. And That first slide that I showed you was of a gentleman from 10 years ago who did very well with that off-label treatment.
Then how do you address the hair loss problem?
Well, hair loss then is a real problem. Once it gets to be scarring, it's irreversible. Only surgical intervention can really make a difference once you've lost the openings to the hair, because now there's no tuft for the hair to grow back out.
Right.
So that's why it has to be looked at early. And unfortunately, a lot of patients present late. They would have had soreness of the scalp, or they may have been treated for other things, especially the older age groups. They may have been treated for a fungus or some other misdiagnosis and present at a stage where it's too late. So a lot of this is someone who gets thickening and it has keloid formation because of the inflammation. So that's why the swelling is so big. But the important thing is, if your scalp is hurting and sore, you should have it checked out, especially if it happens over intervals and affects the vertex or the center of the top of the head or the back of the head by the neck.
Wow.
Okay.
Very
What about
interesting.
this?
Yes, again, this is one of the prime locations, and again, inflammatory swelling, redness, and you know, in the right age group, in a younger age group, it could be a fungus. But when you're someone who's over 12 or an adult, then it's unlikely for you to get a fungus. Very uncommon unless you're extremely unlucky, in which case it's usually bacterial. So in some cases, it's just a matter of trying to figure out what is causing the inflammation and getting the right treatment.
But you know, there's always a problem that some say when you go to a barber and they use a razor on you to give you marks. Does that exacerbate that problem?
Well, if you have a swelling and that's inflamed, then yes, it could by just irritating it. I guess we have the issue of hygiene and the use of implements by the barber. But from looking around, I see most barbers using disinfectants and doing things to try to prevent the transmission of one infection from one individual to the other. So I think we're doing pretty well here. But of course, if you have a skin problem and try to do something that's too aggressive or a haircut that's too low, it's going to make it kind of sore.
So it is contagious. I mean, you can
No,
spread,
this one isn't. The bacteria can be transferred from one person to the other, but it's just that some people can react to it and have this chronic smoldering type of inflammatory hair loss, while others have the bacteria and nothing happens.
Well, it sure doesn't look like you should be using a shared barber's machine if you have that situation back there.
Yeah, well, certainly I don't think many barbers would entertain someone who has an active infection as a client.
Okay. Well, it is certainly good to know what is out there. So it isn't necessarily progressive, but it will be if you don't have it dealt with early.
Yes, the important thing is to identify it and to keep it in check and to seek treatment every time it starts to get inflamed.
Okay.
You know, educating the patient as to what to do and how to keep it under wraps is one of the big jobs of the dermatologist in this case.
So it's reversible before scarring?
Yeah, once you don't get scarring, it can be reversible. That individual that had all the little pus bumps in the head, like there were like 40 or so, they had a total recovery, even though it looked that bad.
One of the things that you always talked about is the potential effects of medication, side effects.
Yes.
Anything that you need to look out for in this regard?
Well, any time someone takes an antibiotic, there can be side effects. They can be simply from swallowing it. You can get nausea or vomiting, but sometimes you can have someone who has an allergy to an antibiotic, which may take the form of diarrhea, especially if tetracyclines are used, or sometimes you can get sun sensitivity and that sort of thing. Or sometimes for women, you can get yeast infections. It's important to know what antibiotics do to you and to have an idea. And of course, if you're taking any medication and you notice that something's changing or happening to you, it's best to inform your doctor at the earliest opportunity so that they can see if it's related to your medication.
Good advice to me.
Very good advice indeed.
Yeah.
Dr. Andrew Ford, our dermatologist. Thanks for waking us up this Tuesday morning.
Yeah, I feel alert now.
Yeah.
we certainly
Yeah,
appreciate
listen,
it.
before you go, there was a fitness weekend.
Yes,
Your people are looking in
2015
fine
All Max
form.
Nutrition National Championship is a great show, 60 athletes, and
Yeah.
we're hoping to get some of the girls and guys for you to
Right
see.
here.
Fitness and health and great bodies.
They look fit.
Yeah.
They certainly look fit indeed.
They were.
They made you feel like getting up and going into the gym, and made you feel like you can achieve anything.
Absolutely.
It's possible. Don't
It
give up.
is, isn't it?
Don't give up.
Okay. wow, it's going to be a journey, but hey, maybe I should try. But we'll start with seeing them right here on Morning Barbados.
Yeah.
Thank you very much, Dr. Andrew Ford, for sharing with us. And we're bringing the girls and the guys. Okay.